Welcome to week 3 of our course, everyone. This is just a quick update with some news from the lab for you because we got very good feedback on our discussion boards last week saying you enjoyed having a little bit more insight about what we do every day when we're not teaching you guys. We've particularly enjoyed the discussion boards this week because there's been some really good insight from you as to how much you appreciated the discussion with the clinicians in particular. So you enjoyed the kind of language, the level that they pitched it at. But also those of you that have either families with liver disease or have liver disease yourself have clearly benefited a lot from the insight that they've given you, so that's really nice to see. It's also interesting that you've sort of echoed some of our comments because we are very keen to kind of raise public awareness about liver disease, and it's clear that that's a message that's got across to you when you've been participating in the course, so you can see that there is this real genuine need to widen awareness about liver disease. In terms of what we've been doing in the lab this week, well, many of you have missed Dave because he hasn't featured very much this week. He's actually had a little bit of a day trip on Monday, so he was involved in some teaching for undergraduate students who are training to become pharmacists. So we were teaching them about the liver because obviously it's important in the context of administering drugs to patients. Obviously the liver will handle those drugs, but also if you have different combinations of drugs then that can cause issues for the liver. So that's why we were talking to the pharmacist this week. Those of you with who are transplant patients as well, again, we should take the opportunity to thank you for donating your old organ for research. So in the lab we have about 40 scientists based here, and we've had 7 liver samples that have been donated this week. So these are old livers from patients who've had a transplant. So there's 40 very happy scientists in our lab this week who've been researching on that material to try and understand, what causes liver disease and what we can do about it. And following on from me now, we're going to give you some examples of actually what's been happening in the lab this week. Thank you very much again for your participation, and do keep letting us know what you think about the course.
So this is Janine and Jill, two of our most senior scientists. Could you tell us a little bit about what you're doing today?
So what I'm doing is I've taken a slice of an explanted liver, I've sliced it up using scalpels, I've then digested it using an enzyme to release the cells, I've then used a density gradient so it separates cells according to size, and now I'm just separating the cells using a magnet. So we've put magnetic beads onto the cells that we want, and we're using a magnet to pull them out.
What liver did you use, Janine?
I used a explant liver, and the disease was cryptogenic cirrhosis.
Could you get a lot of cells out of that?
Cryptogenic cirrhosis are a little bit hit and miss. So sometimes you get a lot of cells and sometimes you don't get so many, but most of our liver preps we do get cells out of.
So this is Scott Davis and Ben Wiggins, 2 PhD students in my lab. Hello. Would you mind telling us a little bit about what you're doing today?
So both of us are currently putting together posters for a conference that we're attending in December. So these are used to summarise our findings that we've recently found as part of liver disease research.
So where is the conference that you're going to this year?
So this year it's in Brighton, and it's the British Society for Immunology conference. It's both of our first conference, so we're really excited about going. Looking forward to presenting.
And how do you go about putting together a poster for a scientific presentation?
So we're a little bit like this. So we start off with this introduction section here, and that just gives the reader a bit of background to the project and just explains why we're doing the research that we're doing. And then we go on to a methods section, which explains how we've done our experiments, so people can understand where we've gone with our experiments and what we're hoping to see. And then we have a results section, which summarises our findings into these little figures here. And then we conclude here. So this just gives us a really good format of how to talk people through our research, and helps them to understand it, and helps us to explain it as well.
And what are you hoping to achieve from going to a conference and presenting a poster?
So I think it's really important for the sort of immunology community to see your work, especially at this conference. There's a lot of big immunologists there who do really good research, and especially a lot of them don't work in the liver, so it's good to get a different angle and ideas about your experimental approach.
Thank you very much.
Thank you.